Your doctor takes your blood pressure. The reading is 124/78, normal. The doctor nods. You feel relieved. You leave the appointment reassured. But what if that number, the one that just reassured both you and your doctor, is not your real blood pressure? There is a condition called masked hypertension. Blood pressure that appears normal in a medical setting, but is significantly elevated in daily life, at home, at work, during normal activity, and critically, during sleep. Studies estimate that masked hypertension affects between 15 and 30% of adults who appear to have controlled blood pressure based on office readings alone. 15 to 30%. And here is what makes masked hypertension particularly dangerous. It is statistically associated with a higher rate of cardiovascular events than even sustained high blood pressure that is being actively treated. Because sustained hypertension is known and managed, masked hypertension is invisible. It is doing damage that nobody is measuring. My name is Dr. Emmanuel Osei. I'm a cardiovascular surgeon with over 2 decades in the operating room. And today I'm going to show you why your blood pressure may be higher at home than at the doctor's, and exactly what to do about it. Stay with me. Let me explain the 2 patterns you need to understand. The first is white coat hypertension. Blood pressure that is elevated in the doctor's office but normal at home. This is caused by the anxiety of the medical setting, the anticipation of bad news, the unfamiliar environment, the presence of a clinician. It produces a real but transient blood pressure elevation. White coat hypertension is common, estimated to affect 15 to 30% of people diagnosed with hypertension. For many of these patients, their blood pressure is actually well controlled in daily life. They may be on medication they do not need. The second pattern, masked hypertension, is the opposite and more dangerous. Normal readings in the office, elevated readings at home and during daily activity. The doctor sees control. The arteries are experiencing sustained pressure that the office visit never captures. What causes masked hypertension? Job stress or caregiver stress, pressure that is elevated during active daily life, but drops when entering the calm of a clinical setting. Physical activity. Blood pressure rises appropriately during exertion, but in some people with early vascular dysfunction, it stays elevated longer than it should. And nocturnal hypertension. Blood pressure that surges during sleep, creating damage through the night while daytime readings look normal. After 60, nocturnal hypertension becomes increasingly common as blood pressure regulation loses its circadian precision. The protective nighttime dip that should reduce pressure by 10 to 20% during sleep is blunted or absent. And office readings, always taken during the day, never see it. Here is the exact home measurement protocol that gives your doctor the most useful data. Measure twice in the morning, within 1 hour of waking, before taking any medication, after 5 minutes of sitting quietly. Record both readings. Use the average. Measure twice in the evening, before dinner, after 5 minutes of sitting quietly. Record both readings. Use the average. Do this for 7 consecutive days. Bring the log, all 14 pairs of readings, to your next appointment. This protocol is recommended by the American Heart Association and European Society of Hypertension as the standard for home blood pressure monitoring. It is more informative than any number of office readings, and most patients have never been told to do it. The equipment matters. Use a validated upper arm automatic cuff, not a wrist cuff. Wrist cuffs are position sensitive and significantly less accurate. Your arm should be at heart level, supported on a table, with feet flat on the floor and back supported. Do not talk, eat, exercise, or use caffeine for 30 minutes for measuring. These conditions are never fully met in a doctor's office. They can be met at home. That is why home readings, taken correctly, are more accurate than office readings. 3 specific situations where masked hypertension is particularly common and particularly underdiagnosed. People with sleep apnea. The repeated cycles of oxygen deprivation and stress hormone release during apnea episodes elevate blood pressure during the night in ways that morning office readings cannot capture. If you snore, if you wake unrefreshed, if your partner has observed you stopping breathing, ask for a sleep study specifically because of its cardiovascular implications. People with diabetes. The autonomic neuropathy that develops with long-standing diabetes impairs blood pressure regulation, making masked hypertension more common and nocturnal hypertension more severe. Diabetic patients should be monitoring blood pressure at home routinely as part of their cardiovascular management. People under chronic psychological stress, caregiver stress, financial stress, grief, relationship strain, Chronic psychological stress elevates blood pressure during active life, while the clinical setting provides a brief but misleading period of calm. The office reading sees the calm. The arteries are experiencing the stress. I want to tell you about a woman I'll call Miriam, 74 years old. She had been told for 3 years that her blood pressure was well controlled. Office readings averaged 122/76. Her doctor was satisfied. She was on a moderate dose of amlodipine. She came to me after 2 episodes of morning headache and 1 episode of blurred vision that resolved spontaneously. These symptoms, in the context of apparent blood pressure control, were puzzling to her primary care physician. I asked her to perform the 7-day home monitoring protocol. She had never done it before. She had a wrist cuff at home that she used occasionally, but inconsistently and without standardized conditions. We provided her with a validated upper arm cuff and the specific protocol. Her home readings told a completely different story. Evening readings averaged 148 systolic. Morning readings before medication averaged 156 systolic. On 3 of the 7 nights, she happened to wake briefly and take a reading. Those nighttime readings averaged 162 systolic. Her office blood pressure of 122 was real. It was what her pressure did for approximately 20 minutes while sitting in a medical environment. For the other 23 hours and 40 minutes of every day, her pressure was doing something very different. Her medication was adjusted. Timing changed to evening dosing. Dose increased. Additional investigation for sleep apnea was initiated. 3 months later, her home readings averaged 128 systolic across the day. She told me, "I had been reassured for 3 years. I was being reassured by the wrong number." That is the central message of this video. Your office blood pressure reading is one data point taken under artificial conditions during a brief window of your day. Your real blood pressure is what your arteries are experiencing right now, while you sit here, while you sleep tonight, while you navigate the stress of your daily life. The 7-day home monitoring protocol gives you, and your doctor, access to that real number. And the real number is the one that predicts what happens to your brain, your heart, your kidneys, and your eyes over the next 10 years. 3 things I want you to do this week. 1. Get a validated upper arm blood pressure monitor if you do not already have one. Look for devices validated by the British Hypertension Society or the American Medical Association validation list. 2. Perform the 7-day morning and evening measurement protocol, 2 readings each session, 5 minutes of quiet sitting beforehand. 3. Bring the complete log to your next appointment and ask specifically, "Given these home readings, is my blood pressure actually controlled?" That question, asked with data in hand, changes the conversation entirely. I want to hear from you. Have you ever measured your blood pressure at home and found it different from your office reading? Has a doctor ever given you a specific home monitoring protocol? Tell me in the comments. If this video gave you something important, share it. For someone in your life who has been reassured by their office blood pressure reading and has never measured what happens at home, send this to them. Everything I've shared today is based on current cardiovascular research and my clinical experience as a cardiovascular surgeon. This is general information, not personal medical advice. Always consult your own doctor before making any changes to your treatment or monitoring routine. Take care of your heart. It has been working for you every single minute of your life without ever asking for anything in return.